Alright gang, sorry I can't be there today, but I did still want to continue on with Chapter 7 so we can get this finished and move on with our dissection and Chapter 8 and muscles and contraction, all that good stuff. So I'm going to give you a little explain everything version of the lecture, and then if you have any questions we can discuss them when I see you guys on Thursday. We are going to continue our discussion of bone growth, also known as ossification or osteogenesis. And what we want to talk predominantly about today is the two types of bone growth in terms of whether the bone is growing in length or growing in width. And then the other thing that's going to be important that we talk about here in this last part is how bone repairs itself after a fracture. So it says here ossification continues throughout life with the growth and remodeling of bones. They do grow in two directions, lengthwise and widthwise. So let's talk about that. All right, so to talk about bone elongation and bone growth, we want to do a little bit of a review of the epiphyseal plate. You guys know that the epiphyseal plate is also known as the growth plate, and that is the region of transition from cartilage to bone. So it's the region where chondrocytes, chondro refers to cartilage, oops, spelled that guy wrong, let's try that again. Chondrocytes change into your osteocytes, right? So osteo refers to bone. It functions as a growth zone where the bones will elongate. It consists of hyaline cartilage. We talked about that before as well. Hyaline, one of the three types of cartilage we talked about in histology. It is a transition zone, so it is where the chondrocytes, as we just said, are replaced by the osteocytes. We said that was a common misconception, that cartilage does not turn into bone. And what happens is that those cartilage cells will start to die off, and then they're replaced by your osteocytes. They're replaced by bone tissue. A term we haven't talked about is called the metaphysis. Now the metaphysis, it says here, is the zone of transition facing the marrow cavity, and this has to do with the growth of the bone. So if we remember, and see how this is a really ugly bone that I'm drawing here, but we talked about the epiphyses, right? So your epiphyses are the ends of the long bone, and then we talked about the diaphysis, and the diaphysis is the center part or the long part of the bone. The metaphyses occur here, and they're at that the metaphyses are at the epiphyseal plate, and they face the side of the marrow cavity. So they're on the side of the marrow cavity, and what they are is they are just that zone of transition, that zone of where you are changing from chondrocytes to osteocytes. It's present in the epiphyseal plate, and as I said, it's on the side of the medullary cavity or the marrow cavity. So that's just a new term for us. All right, so quick review of the bones here, since you guys did your skeletons. If this is a hand, then these bones here, the bones of the wrist, are called the, 3 seconds to think about it. Did you say carpals or carpus? Then you are correct. Very good. Then you have your bones of the hand, also known as the metacarpals. I know you said that before I did. And then your finger bones, which are also the same name if they're the toe bones, are going to be your phalanges. And am I going to run out of room here? Nah, I'm going to squeeze it in. So those are the phalanges. So those are just a little review. Here's a harder question. What bone would this guy be right here? If it's on the side of the thumb, right, then it must be the, did you say radius? If you did, then you're correct. And if that's the radius, over here we have the ulna. So the radius and the ulna. The other really cool thing about this picture, guys, is it's showing you the epiphyseal plates in each of these bones. So anywhere you see this little line here, these are all growth plates. This is where the bones are growing. So here's one. Here's the growth plate of the radius. All these little things here, which is just kind of a cool picture to take a look at. Anyway, moving on. All right, so the first type of bone growth we want to talk about is bones increasing in length, and that is called interstitial growth. It says here, bone elongation is really a result of cartilage growth within the epiphyseal plate. So again, chondrocytes being replaced with osteocytes. The epiphyses close when the cartilage is gone, and you're left with that epiphyseal line. And the epiphyseal line is, once that growth plate has closed up, that is what you'll be left with through adulthood. At that point, once the epiphyseal line is formed, your lengthwise growth is finished. And in terms of which bones stop growing when, that occurs at different ages for different bones, so it's a little bit different for everybody. Okay, next up is oppositional growth, and oppositional growth refers to bones increasing in width. And what this is where you have new bone at the surface. So lengthwise growth is when the bones are increasing in length. Oppositional growth is increasing in width, and it's that new bone, osteocytes, being deposited on the outer surface of the bone itself. It says here, osteoblasts on the deep side of the periosteum deposit osteoid tissue, which then becomes trapped as the tissue calcifies. So I'm just going to draw a little picture for you to kind of maybe help you out with that a little bit. If this is our bone, if you remember, the periosteum is a layer of connective tissue or that surrounds the bone, and what happens is the osteoblasts are present on this side, on the deeper side of that periosteum, and those osteoblasts are kind of hanging out there, and what they do is as osteoblasts do, they start dropping down bone tissue, and then that bone tissue becomes trapped in that space between the outer part of the bone and that periosteum, and then it increases the bone in width. So that's how that works. It says it lays down a matrix in layers parallel to the surface, and that's what forms those circumferential, there we go, lamellae over the surface. And basically it's what causes, if you remember when we looked at the bone in histology, how it looked like the rings of tree trunks, that's where that comes from. It comes from that laying down of bone in a circular fashion on the outer parts of the bone. So that's how that is formed. It says here, osteoclasts of the endosteum enlarge the marrow cavity. So if you remember, let me just erase this word out of here. The marrow cavity had its own connective tissue layer. So if this is our marrow cavity, the endosteum would be lining the marrow cavity. And it says here, osteoclasts of the endosteum enlarge the marrow cavity. So if you don't know what an osteoclast is, I guess we should clarify that there. Osteoclasts break down. So clast means to break down. So osteoclast, because it's bone, osteo refers to bone, clast means break down, that means that they break down bone. So that's what that refers to. So you have your marrow cavity enlarging, and you have the outer part of the bone, you have the marrow cavity getting smaller and the outer part of the bone getting larger as the osteoblasts are laying down more and more bone tissue. So that's how that works. All right, guys, so if you have any questions about this, obviously we can talk about it on Thursday. I don't expect you to, absorb it all, but review it in your notes, and then again, if you have questions, just let me know. All right, let's move on. This next slide I left in here, it's more of an FYI. You don't have to know this for your test, but dwarfism is a type of bone disorder, and there's two types: achondroblastic dwarfism, where the long bones stop growing in childhood. So because the long bones stop growing so early, you have a normal-sized torso but shorter limbs. So that's what causes that. It's failure of the cartilage growth in the metaphysis. So again, if you don't have that cartilage growth in the metaphysis, that's not going to cause the bone lengthening. That's going to cause problems. It says here, spontaneous mutation produces mutant dominant alleles. I'm not going to get into all the genetics of everything, guys, but if you have a mutant dominant allele, I'm just going to say it's not a good thing, and that leads to this abnormal ceasing of the bone to continue to grow. The next type of dwarfism is called pituitary dwarfism, and that's a lack of growth hormone. So it's a lack of the hormone that causes the bones to grow. It says here you have normal proportions, but you're just short in stature. So that is one thing that's different in terms of how the two work. Both considered dwarfism, though. And again, this is just an FYI. Okay, so next up we want to talk a little bit about fractures and how fractures can repair themselves. And there's different types of fractures we're going to discuss. The first one is a stress fracture. And a stress fracture is what typically happens to youngsters such as yourself, and that's a fracture that's caused by some sort of trauma to the bone. So it could be a fall, it could be playing sports. Here they have military combat. These are injuries that occur, and due to the stress put on the bone, it causes the fracture. Another type of fracture is a pathological fracture, pathological referring to disease. So when you have a pathological fracture, it's a break in the bone because the bone has been weakened by some sort of disease, usually some kind of cancer or osteoporosis, which we'll talk about in just a second. And what that does is it weakens the strength of the bone and allows the bone to break more easily. Typically, fractures are classified by certain characteristics, and one is the direction of the fracture line, so whether it goes across the bone or up the bone. Also, if there's a break in the skin, so if you have a break in the skin, that's called a compound fracture. And I know many of you have probably, well, maybe hopefully you haven't, because they're kind of disturbing to see. But I remember last year, I believe there was a basketball player that had an injury, and it was like, I felt like the video was all over the internet, and just whenever you see bone popping through the skin, it's never anything that you want to see. But and then the other type of fracture is where the actual bone breaks into multiple pieces. So let's talk about a little bit more about these fractures and take a look at some pictures. All right, so here are some images of some different types of fractures, and the first one we're going to look at is this one here called a non-displaced fracture. And non-displaced means that there's a fracture in the bone, so you can see the fracture line here. I'm going to erase that just so you can actually see the fracture line after I pointed it out to you. But the fracture line there, and what happens is there's no movement or displacement of the bone, which is why it's named for what it is. So in essence, if this bone were to not be casted, it would hopefully grow normally because of the fact that the bone is properly aligned, and really that's the key there. So Ty had broken a bone, I think I had shared with you guys, and the break was not diagnosed. We had gone to the ER. They said there was no fracture. We took him to an orthopedic 2 weeks later. They said there was no fracture, and then we finally took him to CHOP, and CHOP re-x-rayed it, and sure enough, there was a fracture, but we were actually 4 weeks into the healing process. Luckily, that fracture was non-displaced, and as the bone grew, it grew in alignment, because what happens is if you have something like this, a displaced fracture where the bones are not in alignment, you can actually have bone growth that can cause a deformation in the bone, and you need to go in and re-break it and then do surgery to correct it. So taking a look at this guy, the non-displaced version of a fracture, basically what we're seeing here is the bones are no longer in alignment. So this is showing you a tibia and a fibula. Both the bones are broken and both are out of alignment. So typically for a fracture such as this, they need to go in surgically, realign the bones. Sometimes what they'll do is they'll put in metal plating and screw the bones back together. Sometimes those screws will stay, sometimes they don't. Sometimes they'll go in and remove them, but what needs to happen is that there has to be some type of realigning of the bone. And then that brings us to this guy. This is a comminuted fracture, and this basically is where it breaks into a bunch of pieces. This one typically requires a plate. So what they'll do is they'll go in with the plate that kind of surrounds and supports the bone, and they have to screw the bones into that plate because the pieces are separate, and then the bone is able to grow within the plate and heal itself. The last type of fracture is this guy here, and someone had mentioned they had this fracture. I can't remember off the top of my head. Not that I want to throw your name out there anyway to everybody, but this is called a green stick fracture. This one happens typically in children. And what happens here is that you have a fracture where one bone has the break. So this little arrow here is pointing to the fracture in the bone here. And then the other bone doesn't break, but it gets bent. So one bone breaks, the other bone bends, and that's something that again would require some realigning, possibly some surgery for that healing to happen and to happen properly. So those are just some different types of bone fractures that we can look at. All right, so how do these fractures heal themselves? Well, our bodies are very good at doing that, and there's a 4-step process involved. So the very first thing that happens is a hematoma forms, and a hematoma is kind of like a blood clot. It's basically it's an invasion of blood because we want to have a lot of blood cells there. We need a lot for support. It brings in immune cells. It brings in nutrients to start supporting that tissue, which is now going to be rebuilding itself. It says here the hematoma is then converted to granulation tissue by invasion of cells and blood capillaries. So granulation tissue is kind of like the precursor to what's going to fix and replace that damaged bone. Step number 2, we have a soft callus forming. So you guys probably have heard of calluses before on like your hands. It's basically just kind of like a thickened area of tissue. In this case, the thickened area is going to be your collagen. Collagen, as you may or may not remember, is a type of connective tissue that's involved in repair and in supporting of things. It says here, deposition of collagen and fibrocartilage converts granulation tissue into a soft callus. So the soft callus is important. It's going to be the precursor to the bone, which is going to come in and start, replacing that damaged tissue. Next, we have our hard callus formation. So what happens now is you have your osteoblasts that are coming in. These osteoblasts are very important. Obviously, their job is to make osteocytes and to lay down bone cells. It says here it'll deposit a temporary bony collar around the fracture. So this area here is that bony collar around the fracture. And what that does is that it allows those pieces to unite or come back together again while that ossification occurs. So even if you didn't have a cast, your body kind of creates its own while the bone is healing itself. And then the final stage of healing of fractures is what's called bone remodeling. And during bone remodeling, the small fragments are removed. So whatever is left in terms of little pieces, the osteoclasts will come in. If you remember, clast refers to breaking down, or they're like the cleaners, I guess, almost. And what they'll do is they'll come in and eat up or eat away any little tiny pieces of bone that are left from the fracture, while the osteoblasts are laying down a layer of spongy bone, which will then convert itself as they continue to lay down that bony tissue. It'll convert from spongy bone into compact bone, which is the harder. Anyone who's ever broken anything, you might notice that where that fracture is, it may seem a little bumpy, and that is because your body tends to overheal itself. It'll put a layer of bone there that was probably thicker than it was prior to the fracture, and that's your body's way of trying to prevent that fracture from happening again. So it kind of overprotects itself, which in essence is a really good thing. All right, so taking a look here, this would be a repair of a fracture after surgery, and looking at what they've done here with the screws and the plates, what type of fracture do you think was involved here? If you said a comminuted fracture, then you are absolutely correct. So as you can see, you have the bone broken into several pieces, and what they've done is that they've gone in and they've screwed those pieces together using the screws, and then here on this bone, which is a thinner bone, they've actually put a plate in there, and that plate is holding the bone together, and then the plate is actually screwed into the bone. So this is an ankle that was fractured in several places. So if this is an ankle, what bone must this be versus this guy? I will tell you that the thicker of the bones, which would be your shin bone, that's going to be your tibia, and the thinner of those bones is the fibula. So those are the bones in the lower part of the leg just above the ankle. So in addition to breaking of bones, there's another bone disorder called osteoporosis. It is the most common type of bone disease, and it's something you tend to see in those that are getting older in age, and it's more common in women. So what this is, it's a loss of bone density. And when bones lose their density, they lose their strength. And when you have a loss of bone strength, then you are more susceptible to breaks, fractures, those kinds of things. It says here, bones lose mass and become brittle due to loss of the organic matrix and minerals. So if you remember, it's that calcium phosphate that makes up the bone matrix. and when you start having that worn away, that can lead to brittle bones or osteoporosis, which is why a lot of times as we get older, we take calcium supplements to help prevent the loss of that mineral. All right, so how does osteoporosis happen, and why is it more common in females than in males? The answer is the primary hormone involved in bone density is estrogen. And when we think about estrogen, usually we think females and the sex hormone, the primary sex hormone. Estrogen is actually also found in males. The problem, or the difference I should say, is that as females, as we get older, our estrogen levels will start to decrease. And that's really where the problem comes from. So estrogen starts to decrease. And the function of estrogen in terms of bone density is that it allows for the reabsorption of osteoclasts. So it gets these osteoclasts out of the blood. And if you remember, osteoclasts break down bone. So you don't want these guys floating around in the blood, because what they're going to do is they're going to break down bone. Now, sometimes it's necessary to break down bone, but in normal circumstances, it's not. So you don't want to have a lot of these osteoclasts circulating through the blood. So if estrogen levels decrease, what that does is it causes an increase in osteoclasts in the blood. And then because we have the osteoclasts in the blood, that leads to the breakdown of bone, and therefore the breakdown of the bone matrix and the weakening of the bone. In addition to this happening to women as they get older, because our bodies naturally will produce less estrogen as we age, it's also common in young athletes. I think we may have talked about this before, that, or maybe I talked about it in biology class, but we talked about how sometimes if you have so little body fat, it will start to affect your hormones, right? Because lipids, fats are involved in hormones. And women who have so little body fat, because they're athletes, will sometimes tend to stop getting a menstrual cycle. They'll stop ovulating and stop having a menstrual cycle. And because of that, the reason for that is because the low body fat leads to low estrogen. And in this case, it can cause the same effect as it would in an older woman, even though this is a young female. Same thing though, you have a decrease in the estrogen, which leads to increases in osteoclasts in the blood, which leads to the breaking down of the bone tissue. So it works the same way. Lastly, guys, this is just a photo showing you what osteoporosis looks like. Over here on the right, you can see osteoporosis of the spine. The picture to the left is showing you two sets of bone tissue. The bone tissue on the right, obviously more severe in terms of osteoporosis, but all those holes that are present are not normal. So obviously that's going to lead to some damage if someone were to fall, which is why, we see a lot of breaking of bones in the elderly if they fall, breaking of hips and breaking of legs and those sort of things. So that's just an image for you. All right, guys, again, I'm sorry I couldn't be there today. If you have any questions about anything I went over in these last couple slides, we will discuss them on Thursday before your test, or you can come see me before then. All right, hope you have a great night. I'll see you guys on Thursday.